Large clogged pores? Well, you are not alone. As a board-certified dermatologist, I get this question all the time. How do I shrink my pores? Well, today I'm breaking it down and letting you know what actually works. First off, it's important to take a deep dive into why pores get clogged. Well, there's three main reasons. The first is genetic, so something you can't actually control. Some people have larger pores in the T-zone, or the areas between your forehead and the center of your face, so the nose and the chin. And these are highly sebaceous areas, so areas where more oil is going to be produced. You might have inherited larger pores in that area, so you might notice that one of your parents has more oily skin, and generally with more oily skin, your pores are larger. The second reason pores can get clogged is from excess oil production. So similarly, where we have more oil glands concentrated in that T-zone, those oil glands can produce excess sebum or excess oil for a variety of reasons. The most common reason for producing excess sebum is actually our own skincare practices that lead to over drying of the skin. A lot of things that we place on the skin are harsh and drying and contain alcohols and acids, and when we overuse these types of products and overstrip our skin, we're going to notice even more oil production, and therefore our pores might look enlarged. The last reason for clogged pores is dead skin cells. So if we're not exfoliating our skin properly, dead skin cells can build up on the skin because that rate of cell turnover as we get older has slowed down and the oil is not able to get out, and therefore it stays clogged in the pore. So it's really important to use a product like a retinoid to help increase the rate of cell turnover, and also gentle chemical exfoliants to help exfoliate that layer of dead skin cells. Another reason why pores may become enlarged or clogged are actually hormones. So things like menstruation, stress, and lack of sleep can also contribute to clogged pores and enlarged pores. So it's important to be mindful of all the things that come into play when it comes to the size of your pores. Luckily, there are a few key ways to shrink and clear out pores, and these involve finding products with the right ingredients. Salicylic acid is a BHA, or a beta hydroxy acid, and it comes in many forms over the counter. It comes in toners, creams, facial masks, spot treatments. Products with salicylic acid are great to use if you suffer from enlarged pores or clogged pores. Now, in the spirit of not over drying the skin, it's important to use them sparingly, so once a day and then cover with a moisturizer, or if you're using a mask with salicylic acid in it, I recommend just using it 1 to 2 times a week. But daily use of salicylic acid in the T-zone after washing the face in the morning or in the evening can really help to clear out sebum or excess oil so that your pores can actually close. Another key ingredient is niacinamide. Not only does niacinamide help reduce oil production, it also helps to reduce redness. So in patients who are oily and red, so a lot of rosacea patients or patients with sensitive skin, niacinamide combined with other ingredients in a product or even as a standalone is a great way to help reduce sebum production and also reduce any redness on the skin. Now, I love masks, and I know that there's so many on the market, it's hard to know which one is right for you, but in the case of enlarged pores and excess oil production, you're going to want to find yourself a clay mask or a mud mask. These are great for oily skin. Now, they can be very drying, so you want to use them sparingly once or twice a week, but after putting on a nice clay mask, your skin feels so refreshed, so clean. Take it from me, you will love clay or mud masks. The last ingredient that can really help with excess oil production and enlarged pores is retinoids. So retinoids or retinols, my favorite over-the-counter retinol actually is adapalene or Differin. You can buy this at your local drugstore, and again, it's great to spot treat in the T-zone area. Retinoids are a great treatment for enlarged pores and clogged pores. What they do is help promote that cell cycle turnover so that dead layer of skin cells don't build up on the surface. With regular retinoid use, especially in the T-zone area, you can appreciate your pores shrinking down to their normal size and also less sebum getting trapped and clogged inside the pore. Now, in the office, there are a number of professional treatments we can do as well to help with enlarged pores. The first being using that same key ingredient of salicylic acid. We can do chemical peels in the office with salicylic acid. I have patients who come in for these regularly, as often as every 2 to 4 weeks. And we peel the entire face with 30% salicylic acid, which is a much higher medical grade percentage than you can get over the counter. Typically over the counter, you can only find about 2% salicylic acid. So these peels are very effective for dissolving sebum, helping with any inflammation on the skin, helping with any active acne, and also shrinking pores. Microneedling is another great option for treating pores and helping with overall skin rejuvenation. It can be a targeted therapy for the T-zone, for enlarged pores, for acne scars, for fine lines, wrinkles. It's really a nice treatment overall. And one thing I like about microneedling is you can apply a product like a chemical peel right on top of the skin post-treatment. Now, we've just created a controlled injury using a mechanical device with tiny little microneedles to the entire face. And I'm sure you've heard of the vampire facial. So yes, post microneedling, you can apply topicals on the skin that are safe for penetration. So PRP, or platelet-rich plasma, is one of those ingredients. While it doesn't necessarily help with pore size, it can help with overall facial rejuvenation and wound healing. Sometimes I'll apply salicylic acid right after we microneedle, just to the more oily, enlarged, pore-prone area. And so that can really help because it enhances the penetration. Now, this is an advanced technique type of procedure, so I wouldn't recommend you to try it at home or go to a local spa and ask for this treatment. But when applied in the office of a board-certified dermatologist, it can actually be really effective. One of the other things we do in the office that help with shrinking pores is a laser. So we can use lasers that deliver heat to the skin, and the heat itself can help to shrink the pores. The treatment I love for pores is called the Laser Genesis. It's a 1064 nanometer laser, and we literally just kind of paint the skin with this device. It's very tolerable. There's no pain. It's just a gentle warming of the skin. This can be a really nice in-office treatment for pore size and overall facial rejuvenation as well. All in all, healthy pores equal healthy skin. If your pores are enlarged and your skin is irritated, let's start with some of the things we discussed prior in this video to help shrink your pores back to their normal size. And remember the things that you can't control, like your hormones, but it might be worthwhile getting a hold on things you can control, like stress, diet, and sleep. If you found this video helpful, drop a comment in the notes below and let me know which tip you'll be trying first to help with your pores. And don't forget to hit subscribe for more dermatologist insights. See you next time.